JeffHOPE is
passion,
enthusiastic,
amazing,
hands-on.
JeffHOPE is
community-focused,
Public health,
one-on-one counseling with
interdisciplinary teams.
JeffHOPE is Prevention Point,
Sunday Breakfast Rescue Mission,
Liza Shirley,
Our Brothers Place Shelter.
JeffHOPE is a student-run clinic
that serves the underserved in Philadelphia, homeless shelters throughout the city.
That has expanded from one site to many sites, involving a lot more students than it used to.
When we started, there was just 7 students and Dr. Plum, our faculty advisor.
And it's changed students' perceptions of what homelessness is. It changed mine.
We are a shelter for women and children. They come into the city and they're looking for housing if, for whatever reason, they're no longer able to reside in the residence that they're used to. And the first place they would go is here. We're an emergency shelter.
I am seeking a home for me and my son.
I had 3 strokes in 4 months while I was in the process of moving. All my stuff got moved into storage between hospitalizations. And the next thing I know, I was homeless.
I lost my job and I lost my house.
Been on my own for a long time and I just fell short and things happened. Life happened. Decided to move to Philadelphia and don't have no family here, nothing. My first place I came was here to the shelter and they've been looking out for me ever since I've been here.
Sunday Breakfast Rescue Mission is a program to reach out to the homeless.
Prevention Point is a social services organization based out of Kensington.
So Liza Shirley is an intake shelter for women and children in the city of Philadelphia.
And having JeffHOPE right here in the facility means that they don't have to go elsewhere and that they can get some immediate help with some of those physical problems that have been bothering them for an extended period.
You know, I like to think of us as a primary care setting, but we oftentimes catch diseases that have progressed pretty far to being life-threatening. Great examples are we often see cases of hypertensive urgency, hypertensive emergency. We may see unstable angina.
So that's really exciting, right? That we can sort of catch people in acute situations and help them sort of get sort of the evaluation and care that they need.
At Prevention Point, in terms of the medical care, we offer similar services as a primary care office. So we give out vaccines like the flu shot right now, pneumococcal, meningococcal, Tdap, Gardasil, a whole line of vaccines that are free and available to patients. Whether it's primary care, whether it's nutrition, whether it's joblessness, we help with everything.
It's an opportunity to work as a medical team because the PT students go out there, the occupational therapists, the nurses, the pharmacists, the podiatry students from another medical school. It's just a great way to learn what the entire medical team is doing for your patient.
The Kids Committee at JeffHOPE.
I'm a second-year physical therapy student.
Rapid HIV testing.
Procedures Committee.
Advocacy Committee.
On the Research Committee.
I'm on the Pharmacy Committee.
I am a second-year family medicine resident at Jefferson.
All these committees resemble the jobs that people have in real hospitals. And so being able to work with these people to help one patient is what's going to be happening in the real world.
The purpose of the Kids Committee at JeffHOPE is to play with the kids at the shelter while their mothers are receiving treatment by the clinicians and student doctors.
Sometimes the mothers are busy with stress or being homeless and they don't really have time to read books with their kids.
We're trying to increase literacy in the children that we see at clinic and give them books every time they come here and encourage reading.
Not only to enhance reading and learning, but to give the kids something tangible that they have. Sometimes in a shelter it's hard for kids that are so restricted in a lot of things to have a lot of things that are their own, and we want to provide to them, each and every one of them, a book that they can call their own. They can read whenever they want.
So a lot of the patients here don't have insurance and they can't really afford their medications even if they do have insurance. So what we do is we have a stock of medications and we can give it out if the patients need them.
They have people double checking the medications they're getting. They have the individual attention of someone talking to them about the side effects of their drugs, drug interactions, and that they can ask questions and get them answered here.
JeffHOPE gives us an outlet for students to continue to demonstrate their altruism, and even though there's a lot of other clinical experience that we try to get into the first year, this is real clinical experience.
You have first years coming out within a month of starting med school. They don't know anything. And they're there and they're working with other students to help teach them.
Lower year is going to work with an upper year as a team and then a pharmacy member.
And I think being able to learn from each other, it kind of helps piece together what the important parts are. The first and second years learn, this is how to do a physical exam. The third and fourth years learn, this is how you teach someone do the physical exam. And while they're teaching, they're also learning from the person above them. So I think it's nice to be able to kind of go up through that pattern, and everyone, again, is learning from each other, and you can teach the things that they don't know, and you kind of just fill in those knowledge gaps.
I'm really proud of the way JeffHOPE has contributed to the education of Jefferson medical students. I think they've learned some clinical skills, and I know that's a big part for the students. They like getting out there and actually seeing people, but I think they've learned much larger lessons about our society and about poverty and about things we can do to address these larger issues.
You really realize here that someone can have a medical problem, and if you don't sort of bring a network together of, a social work component, an employment component, a psychiatric component.
What they're really getting is connecting with the patient, learning from them, learning their stories and how they can help humanity one person at a time.
I mean, I came into med school knowing I kind of wanted to do primary care, but working at JeffHOPE and kind of seeing the needs of Philadelphia, I really got into urban underserved care and ended up being the main aspect of residency programs that I looked for, and kind of was one of the reasons why I ended up at Jefferson as a resident.
JeffHOPE was the single most influential factor of my years at Jefferson as a medical student, and it set the direction for my career moving forward, and I'm very grateful to Jefferson.
When I think of patients that I've had throughout my medical school experience, a lot of them have been here at Eliza Shirley.
They make your day pleasant.
You don't have to be embarrassed or ashamed, because there are people out here is willing to help.
And it made me feel good that he remembered my name. Out of all the people that they see up here, he remembered my name. That just made me feel good. Shows that they care.
It's really been inspiring, and it's great, as a medical student when you're studying and you're learning about all these things and you're just totally stressed out, but then you do something like JeffHOPE and you realize while you're doing it, and you kind of get a sense of the altruistic nature, that is medicine and is JeffHOPE.
I think I'm blessed. I really do.